So if you are a very low body weight and you're at a BMI of under 18, there could be some serious complications that come with refeeding. Your body systems can shut down so severely that your body actually loses the ability to digest food properly. And so if you suddenly bombard your body with a lot of calories without any medical supervision, you can have all kinds of things. You can have a heart attack, you can have bowel obstruction. I'm not going to get too much into it, but because I know that other people will be addressing this topic but there are many problems that can come with, it's called refeeding syndrome. And some of the signs, if you have any sign of heart pain, chest pain, or heart attack can be one of the issues. So chest pain, shortness of breath, tightness in the chest, unusual dizziness or tiredness despite eating, any pain in your lower back, that's a constant radiating pain, pain in your upper right quadrant of your abdomen that could indicate a liver problem or a gallbladder problem. So those are some of the issues that can come with refeeding. And if you have any of those, and if you are underweight, it is imperative that you get the medical help, because there are ways, if you're that much underweight, most likely you really need to be in an inpatient facility where they may even do TMP until you're gain enough weight or stable enough that you're able, and then slowly reintroduce food. So you have to be really careful when you're taking if you take recovery on your own, that you're medically stable enough that you're not going to actually make things worse. Now, obviously, the eating disorder itself is probably worse, but you have to be really careful about how to go about with recovery. Now, one thing I would say as well is one cause of death among people with eating disorders is electrolyte imbalance. That can happen with anorexia or bulimia, but especially with bulimia. And this isn't, permission to purge or condoning it in any way, but if one of the signs of electrolyte imbalance is a really low heartbeat. I know when I was, before I was really recovering, I had this happen to me several times. I was a restrictor, but also I purged a lot. I'm in a lot. And I had a few times where my heart rate, I could sit down and I could feel that my heart rate was beating like at 30 beats per minute, 40 beats per minute. That's, I'm a runner, so I have a lower heartbeat, but that's too low. When your heart rate gets to the 40 beats, 30 beats, 20 beats per minute, there was one time it was even 20 beats per minute, you get dizzy, nauseated, you just have no energy, a lot of confusion, and that is a very dangerous place to be. And now at that point, I probably should have been hospitalized, but I didn't. What I did do was I always took some broth or some kind of electrolyte replacement, and usually broth would help me. So if you are in that place, I really encourage you to get medical help immediately, and not do what I did. But I also encourage you to keep that in mind, that your electrolytes can really get messed up with bulimia especially. So, I know sometimes you feel like, well, you can't do anything about it because you did it to yourself, but really you can, and you need to pay attention to that. And so if that means that you need to take some kind of supplement to keep your electrolytes a little bit balanced, then that may be an appropriate thing to do. I'm not telling you that it is for you, you might need to check that out with your doctor or healthcare provider, but but for me, that was very critical. That was it probably kept me from dying a few times, because I was really in a bad state, and I just absolutely refused to go to the hospital. I didn't want that label. I didn't want my family to know why I was sick, and so, I probably would have died before going to the hospital. Luckily, I didn't. Luckily, some of those things worked, but you need medical intervention, and don't replace that. But as a precaution, taking electrolytes throughout the day, adding it to your water, is probably not a bad idea. So there are things that you can do when you're in the recovery process, because nobody's going to be perfect. It's just everybody relapses, everybody slips up. Recovery is such a rocky process. You go up and you go down and you go up and you go down. And for a while it seems like you're not getting better, and it's not easy. And so when you're in those moments, first of all, you have to realize that it happens. It's normal. It's a normal part of recovery. And so we tend to want to think, okay, we've screwed up, we're a failure, and we can't recover. But we have to learn from those situations. But when that does happen, please do whatever you can to take care of yourself and minimize the damage. And, minimizing the damage is not going to mitigate the damage. It's not going to stop the damage. The damage is still going to occur, but it may keep an acute situation from becoming critical. So, those are the things that are really important. Now, other things, if you have bloody stools, bloody urine, if you're purging and you have blood, that can get the blood in when you're purging can indicate stomach or esophagus tears. That's important to get medical help for. Bloody urine or stools can indicate bloody urine can indicate kidney problems. You can have kidney failure with an eating disorder, whether you're anorexic or bulimic, and bloody stools that you can have internal bleeding. Your internal organs can be subject to internal bleeding when they're weakened to that point. So really, those are things that you need to watch out for and get medical help. And even if you have to go to your emergency room and that's all you have, then when you do go there, please be honest with them and tell them you have an eating disorder, because they need to treat you differently, and if they don't know that, you need to ask for somebody that understands eating disorders, if there's anybody available at all, because in some of those cases, they need to treat your condition differently than they would somebody walking off the street. And if you don't tell them, they're gonna treat you like any regular person walking on the street with an unknown heart condition or whatever condition it is. But if they know what your eating disorder symptoms have been, they're going to be able to get you the right help faster and maybe save you your life and save you from further damage that would come from delaying the care that you need, because they're trying to figure out what's wrong with you. They have no clue. So they're only as good as the information you give them, and if you don't give them the information that's going to help them to help you, it's going to be frustrating for them, and it's going to be probably could be detrimental for you. So I know it's a hard thing if you haven't talked about your eating disorder, and there's a lot of shame and guilt involved. But just realize that you have a disease, and while yes, the actions are yours, I would not say a person with an eating disorder that it's 100% all their fault. I mean, there's a lot of different factors involved. And so you have to lie aside the guilt and accept the help that is there. So that's my advice to you, and I hope you have a good